Good afternoon. I'm joined by the Chancellor of the Exchequer and the Secretary of State for Health and Social Care, because today we're setting out our plan to help our NHS recover from the pandemic and build back better by fixing the problems in health and social care that governments have avoided for decades. We all know someone whose test, scan or hip replacement was delayed, or who helped protect the NHS amid the immense pressures of COVID by putting off treatment for a new medical condition. And now, as people come forward again, we need to pay for those missed operations and treatments. We need to pay good wages for the 50,000 extra nurses we're recruiting, and we need to go beyond the record funding we've already provided to the NHS. And that means going further than the 48 hospitals and 50 million more GP appointments. So today, following the most successful vaccine programme in the world, we're beginning the biggest catch-up programme in the history of the NHS, increasing hospital capacity by 110% and enabling 9 million more appointments, scans and operations. And I have to level with people, waiting lists will get worse before they get better, but compared with before COVID, by 2024-2025, our plan will allow the NHS to aim to treat 30% more patients who need elective care, like knee replacements or cancer screening. A recovery on this scale cannot be delivered by cheese-paring budgets elsewhere, and it would be irresponsible to cover a permanent increase in health and social care spending with higher day-to-day borrowing. For more than 70 years, we've lived by the principle that everyone pays through our taxes for the NHS, so it's there for all of us when we need it. In that spirit, from April, we will have a new UK-wide 1.25% health and social care levy on earned income, with the money required by law to go directly to health and social care across the whole of our United Kingdom, and with dividend rates increasing by the same amount. This will raise almost £36 billion over the next 3 years, not just funding more care, but better care, including better screening equipment to diagnose cancer earlier and digital technologies allowing doctors to monitor patients in their homes. The levy will share the cost as fairly as possible between people and businesses, because we all benefit from a well-supported NHS and all businesses benefit from a healthy workforce. And those who earn more will pay more, including those who continue to work over the state pension age. The highest earning 14% of the population will pay around half of the revenue raised. No one earning less than £9,568 will pay a penny, and most small businesses will be protected, with 40% paying nothing extra at all. And this new investment will go alongside vital reform, because we learned from the pandemic that we can't fix the NHS unless we also fix social care. When COVID struck, there were 30,000 hospital beds in England occupied by people who would have been better cared for elsewhere. And the inevitable consequence was that patients couldn't get the hip operations or cancer treatment or whatever other help they needed. And those people were often in hospital because they feared the costs of care in a residential home. If you suffer from cancer or heart disease, the NHS will cover the costs of your treatment in full. But if you develop Alzheimer's or Parkinson's, then you have to pay for everything above a very low threshold. Today, 1 in 7 of us can expect to face care costs exceeding £100,000 in our later years, and millions more live in fear that they could be among the 1 in 7. Suppose you have a house worth £250,000 and you're in a care home for 8 years. Then once you've paid your bills, you could be left with just £14,000 after a lifetime of work and effort and saving. having sacrificed everything else, everything that you would otherwise have passed on to your children, simply to avoid the indignity of suffering. So we're doing something that frankly should have been done a long time ago, and share the risk of these catastrophic care costs so that everyone is relieved of that fear of financial ruin. We're setting a limit to what people will ever have to pay, regardless of assets or income. In England, from October 2023, no one starting care will pay more than £86,000 over their lifetime. No one with assets of less than £20,000 will have to pay anything at all, and anyone with assets of between £20,000 and £100,000 will be eligible for means-tested support. And will also address the fear that many have about how their parents or grandparents will be looked after. We'll invest in the quality of care and in carers themselves, with £500 million going to hundreds of thousands of new training places, mental health support for carers, and improved recruitment. Making sure that caring is a properly respected profession in its own right. And will integrate health and social care in England so that all elderly and disabled people are looked after with the dignity they deserve. No Conservative government wants to raise taxes, but nor could we in good conscience meet the cost of this plan simply by borrowing the money and imposing the burden on future generations. So I'll be absolutely frank with you, this new levy will break our manifesto commitment. But a global pandemic wasn't in our manifesto either. And everyone knows in their bones that after everything we've spent to protect people through that crisis, we cannot now shirk the challenge of putting the NHS back on its feet, which requires fixing the problem of social care and investing the money needed. So we will do what is right and reasonable and fair. We'll make up the COVID backlogs, we'll fund more nurses, and I hope we will remove the anxiety of millions of families up and down the land by taking forward reforms that have been delayed for far too long. Thank you very much. I'm now going to hand over to Rishi.
Thank you, Prime Minister. Good afternoon. I'd like to address straight away the following question. Why do we need to raise taxes? 3 reasons. First, we need to properly fund the NHS as we recover from the pandemic. Senior NHS leaders have made clear that without more funding, we will not properly be able to address this significant backlog in people's cancelled operations, delayed treatments, or missed diagnoses. To get everyone the care they need is going to take time, and it is going to take money. The second reason is that the social care plans announced today have created an expanded safety net. Instead of individuals having to bear the financial risks of catastrophic care costs themselves, we as a country are deciding to share more of that risk collectively. This is a permanent new role for the government. And as such, we need a permanent new way to fund it. The only alternative would be to borrow more indefinitely. But that would be irresponsible at a time when our national debt is already the highest it has been in peacetime. And it would be dishonest. Borrowing more today just means higher taxes tomorrow. The third reason we need to raise taxes is to fund the government's vision for the future of health and social care. Properly funded, we can tackle not just the NHS backlog and expand the social care safety net. We can afford the nurses' pay rise, invest in the newest, most modern equipment, prepare for the next pandemic, and provide one of the largest investments ever to upskill social care workers. In other words, we can build the modern, more efficient health and social care services the British public deserves. To fund this vital spending, we will introduce a new UK-wide health and social care levy. From next April, we will ask businesses, employees and the self-employed to pay an extra 1.25% on earnings. All the money we raise will be legally ring-fenced, which means every pound from the levy will go directly to health and social care. The levy is the best way to raise the funds we need. It is fair. The more you earn, the more you pay. It is honest. It is not a stealth tax or borrowed. The levy will be there in black and white on people's payslips. And it is UK-wide, so people in England, Scotland and Wales and Northern Ireland will all pay the same amount. To make sure everyone pays their fair share, we will also increase dividend tax rates by the same amount. And from 2023, people over the age of 66 will be asked to pay the levy on their earnings too. No government wants to have to raise taxes. But these are extraordinary times and we face extraordinary circumstances. For more than 70 years, it has been an article of faith in this country that our National Health Service should be free at the point of use, funded by general taxation. If we are serious about defending this principle in a post-COVID world, we have to be honest with ourselves about the cost that brings and be prepared to take the difficult and responsible decisions to meet them. Thank you. I'll hand over to the Health Secretary.
Thanks, Rishi. As the Prime Minister and Chancellor have just underlined, this is such an important moment for the health and social care services in our country. Over the past 18 months, we've seen how everyone working in health and social care has moved mountains. They've treated over 500,000 patients with COVID. They've jabbed 90 million times. And they've cared for our elderly and the most vulnerable at a difficult time. Inevitably, this has taken its toll. And it's right that we urgently address it, even when that involves taking some difficult decisions. Yesterday, we announced a further £5.4 billion to support the NHS over the next 6 months. But we're all clear. This is also the moment to invest in health and social care for the long term. It's easy to get lost in some of these big numbers, so I want to set out why this investment is needed and where it is going. First, the NHS. Over the weekend, I met health ministers from the world's biggest 20 economies. We're all in the same boat, left with the consequences of a destructive global pandemic. Here at home, before the pandemic, 9 in 10 people were treated within 24 weeks. Now, it's 45 weeks. Today, we have a backlog of 5.5 million people and the potential for that to rise even higher. I think we can all understand why this has happened. But none of us on this podium are prepared to stand by and watch that figure go as high as 13 million, which is what would happen if it was business as usual. That would be inexcusable. And the responsible thing to do is to act now. The majority of funds from the new levy will initially go into the health service. Together, we're investing in the biggest catch-up plan the NHS has ever seen and carrying out 9 million more checks, scans and treatments. For instance, we're going to ensure that the vital work of routine operations, things like hip replacements, cataract surgery, never stops. And we're also investing in the next generation of scanners, screening equipment, so that we can find deadly diseases like cancer much more quickly. All of this builds on the historic levels of funding that we've already provided. Since the 2018 settlement, we've increased the health budget year on year to record levels. Because we've all taken our responsibilities to the NHS very seriously. And as the Prime Minister just set out, this is also the moment for another historic settlement. the moment to stop the crisis in social care and end the lottery of how we all pay for it. Around 1 in 7 people end up spending over £100,000 on their social care, and often the heaviest burden falls on those that are least able to bear it. That's not right, it's not fair, and we're going to put an end to it. From October 2023, no one will have to pay more than £86,000 in care costs over their lifetime, and that cap will be there for everyone, regardless of any conditions you have, where you live, how old you are, or how much you earn. We're also casting the safety net further. No one with assets less than £20,000 will have to make any contribution from their savings or housing wealth, and that's up from £14,250 today. Anyone with assets between £20,000 and £100,000 will be eligible for some mean-tested support. We know charging reform alone is not going to be enough, so the wider work of reform also begins now. This includes investing more than £500 million in the incredible social care workforce, ensuring that unpaid carers get more support and advice and respite that they need. And we're publishing an integration white paper that will help us deliver health and care as one. So we're making these historic investments in health and social care together. They've shown how serious we are about tackling the challenges that we face, the backlog, the social care crisis, and we're not going to leave these challenges to future governments or future generations. We're making these investments together so that many millions more get the chance to live happier and healthier lives. Thank you, Prime Minister.
Thank you very much, Saj, and thank you, Rishi. Let's go to the media, and could I possibly ask, rather than asking each of us one question, could you possibly try and target your questions at one of us, and we'll try and get through as many as we can, or just target one question at whomsoever you choose. Laura Koonsberg, BBC.
Thank you very much, Prime Minister. I think it'd be a shame with the three of you here if we're not actually able to hear from all of you, but we'll see how we get on.
I thought that was probably going to be a faint request. Anyway,
well, to you, a small proportion of this huge amount of money will come from dividend tax, but what is fair about a huge tax rise, Prime Minister, that will overwhelmingly be borne by working people while the expensive properties of wealthy pensioners are protected? To the Health Secretary, but you can answer this yourself if you would like, getting £5 billion out of £36 billion in the next 3 years is going to social care. But what guarantee can you give people that money will actually go to social care, and that over time social care will get more of this new levy? And if you can't give us a concrete guarantee, then how are people to believe that the reform to social care is real? And to the Chancellor, taxation is going to hit its highest ever share of national income, according to the IFS this afternoon. Can you tell the public with a straight face that the Tories are still the party of low taxation?
Thanks very much. I knew that was going to be a vain request, but never mind. You're quite right. You're quite. It's a very important subject, and you're right to want a range of questions. On the fairness issue, don't forget what is happening here. We're in the measures that we're setting out today. We're protecting everybody's assets of up to £100,000, and if you remember beforehand, that was down £23,000. That's more than 4 times as much protection. So people up and down the country, wherever they are, who have assets up to £100,000, will find that they get help. We're lifting the threshold, the minimum that you have to have before you can be asked to pay, lifting that up to £20,000 from £14,000. So that's a very progressive measure. And the Institute for Fiscal Studies have themselves said today that this is a progressive and broad-based measure. And it's quite right that those with the broadest shoulders should bear the biggest burden. And that's exactly what we're doing, because the 14% of the wealthiest 14% of the population will pay at least half of this burden, of this tax yield. And I just say to those who say we shouldn't be raising taxes now. I think everybody knows the extent of this government's commitment, of the financial commitment that the government has made to the country during the pandemic. £407 billion to provide jobs, to support jobs and livelihoods through all manner of schemes. It's been hugely expensive, but it's been the right thing to do. But it's also now the right thing to do to take reasonable, fair, responsible steps to put the NHS back on its feet, and that's what we're doing.
But Prime Minister, plenty of people don't have assets, they have wages. And people who have wages and no assets are the ones who will pay here.
But everybody, Laura, everybody has relatives who can potentially face the costs of care, who need better service in the care sector. Everybody, every family in this country faces this risk, and everybody has needs our wonderful NHS, and everybody has, as I said at the beginning, has an aunt or a friend and we all know somebody whose treatment has been delayed as a result of the pandemic. Everybody needs those waiting lists cleared, and that is what this is about. But Rishi and Saj.
Thanks, Prime Minister. Laura, I'd start by saying, echo what I said in my remarks. None of us standing here wants to be in a situation where we have to raise taxes. But I think the Health Secretary Saj set out a powerful rationale for why extra investment is needed, which I think people will understand. And look, there is no easy or perfect way to raise money. I'm not going to pretend that there is. We've set out why our approach, this new health and social care levy, is the best way to do it. It means we can do it on a UK-wide basis because we are a government that believes in the union and the strength of the union. Doing it this way allows us to make sure that that is a reality. It also means that we do it, as the Prime Minister said, the IFS have called it a broad-based and progressive way to do it, and it ensures we get a widest possible participation. So, as I said, look, there is no perfect or easy way to do it, but I think there is a compelling case to do it, and I think we have reasons why we think this is the best way. And even if people don't like that, and I can certainly sympathise with that and appreciate that, hopefully they will at least respect the honesty and the responsibility that we're showing towards this issue and the way we're going about tackling it.
And Laura, if I can just add to that, if we had done nothing, business as usual, as I called it, we're being told, my officials were telling me the waiting list could rise to 13 million. We were not going to tolerate that, and that's why we took these difficult decisions to do the right thing. I think what anyone would expect from a responsible government, and to set out our plans clearly. And in terms of how that money is split, it's right that absolutely most of it in the early years especially is going to the NHS, because that's where we have the pandemic emergency and we have to deal with this backlog. And but over time, more and more will start going into social care, into these new plans. Of the 36 billion, 5.4 billion at least will be going into adult social care, and that will be covering all sorts of new spending. This is additional spending into adult social care on top of what the government already provides, including, for example, supporting 700,000 new places for training, workforce development support, and also more money to local authorities so they can give providers a fairer cost of care.
Thanks very much. Anushka Astana, ITV.
Prime Minister, the tax rise isn't the only manifesto promise that you've broken today. The £86,000 cap cannot guarantee that no one will have to sell their home, and the triple lock on pensions has been scrapped. How can voters believe what you say? And to the Health Secretary and to the Chancellor, those currently in the care system will not benefit from this cap. That is not fair, is it?
Thanks very much, Anushka. And I just repeat what I said. Of course, you're right, but COVID was not in the the manifesto either. And what we're dealing with is two things at once. We're using the health and social care levy, which I think is the right thing to do, a legally hypothecated levy, to address the backlogs in the NHS, the waiting lists, so people get the treatment that they need. But we're also, for the first time in decades, doing something that no government has done before, which is fixing one of the underlying problems that causes those delays in the NHS, and that is the crisis in social care and people's anxiety about where their relatives should best be treated. And the phenomenon of delayed discharges is partly caused by that anxiety and by the problems we've got in social care. So that's why the two things fit together, and why you can't fix the NHS without also tackling the long-term problems of social care. And I think that is the right thing to do. And if people look at our manifesto, they will also see that we pledged to fix social care after governments had failed to do it for decades. And we also pledged to be fiscally responsible. And not to run up excessive deficits, excessive debts. And I think that people will see that in the current circumstances is also the right thing to do.
And Pierre, I can just add to that, if I may, that it is the case that these policies on adult social care, they will kick in from October 2023. And yes, it is. Those that are the other side of that date, it won't apply to them. And that is the case for any new major policy change. Unfortunately, there will be people sometimes that are the other side of a start date. And I completely understand the concerns that have been raised by people affected, or I guess not affected in that way. But it's important that we just get on with this change. It's a big change. It's going to take time to get it right. We need to consult and work with local authorities and many other stakeholders in this sector, and we'll do that and get it right and start it on time in October 2023. Thanks.
Beth Rigby, Sky News.
Prime Minister, you said in the Commons today that you don't break manifesto commitments lightly. You told that to your MPs. But it's not the first time you've promised things to voters and then you've broken them. And I'm thinking about no checks in the Irish Sea between GB and NI. You promised no cuts to the foreign aid budget. You promised to keep the pension triple lock. You promised no tax rises. Breaking promises appears to be part and parcel of how you conduct business in your government. When you were making this decision, was there not part of you that worried about it and thought that at some point voters will lose faith in you and you will lose credibility, not just for yourself, but for the Conservative Party as well? And to the Chancellor, you are traditionally a Chancellor who is in favour of low taxation. You're a smaller state Conservative, as is the Health Secretary. Indeed, you're a Thatcherite, I think. You've announced today a £10 billion tax rise for workers on top of a £25 billion tax rise in the budget by freezing income tax allowances and thresholds. Are you comfortable with the Conservative Party losing its reputation as a party of low taxes? And will you commit today to actually not raise any more taxes in this Parliament? So perhaps, Prime Minister, if you like a read my lips moment.
Read your lips, Beth. I'm going to listen. Of course, you're right about what you say. Nobody lightly wants to raise taxes, as Rishi and I and Saj have all said. But the fact is that nobody in any manifesto that I read saw a pandemic coming in which the country had to spend many billions of pounds, 407 billions, supporting people up and down the country and putting us in a fiscally very difficult situation, or putting a great deal of pressure on our finances. And what we did say in that, and we said two things in that manifesto, that I have to take a judgment, make a choice about what I think is the higher priority. And I think that what the people of this country will want after what we've all been through is honesty and fairness and rationality about the situation, and that means making sure that we don't just leave the burden to mount up for future generations, that we do address the costs of the pandemic on the NHS, which have been colossal. We need to fix those now, but we also need to fix one of the underlying causes of problems in the NHS, social care, which has been shirked by governments for decades, and which will help us to fix the problems in the NHS, and also, by the way, enables us to fulfil an important manifesto commitment and enables us to deliver on the promise I made on the steps of Downing Street. And I actually think that this will make a huge positive difference to millions of families up and down the country, and I think it's a very important moment for this country.
How would you have paid for it then? You made the promise on that in the steps of Downing Street. How would you have paid for it? You're using the pandemic as cover, aren't you, to break tax promises?
No. I think most reasonable people can see that as a result of the expenditure that has been necessary and the hit that the economy has taken, the fiscal position is very different from anything that could reasonably have been foreseen before the manifesto. So you've got to adjust and do the things that I think are the priority of the British people. And I believe that this is our national priority. I believe our NHS is our national priority, and I don't think you can fix the NHS without fixing social care. Rishi.
Just add on that, Beth. You asked how will people view us on these matters, which is totally fair. I think, first of all, people hopefully will recognise that we do face extraordinary circumstances, and you put some big numbers on the tax side. Yeah, but equally, people also know we borrowed more last year than at any time since World War II. Right? We're borrowing more this year than any year since last year, and our debt is at a peacetime high. So people recognise we're grappling with difficult times. And you said, what will your reputation be? Well, hopefully, people will know that we should have a reputation for being a party and a government that is responsible with the nation's finances. And that is really important to all of us standing here. It's a commitment that we always make to people, and they recognise that sometimes that means you have to do difficult things. And I would say to people, you can trust us to be not just responsible, but take the difficult decisions when they're necessary in the best interests of the country. And that's what today's approach is all about.
Prime Minister, will you just rule out any more tax rises so everyone has to swallow an NI rise for workers? Will you actually just tell the public, now that's it? You're not going to spring another tax rise on them in this Parliament?
As Beth, I admire your approach, but of course, all fiscal matters are matter for the Chancellor. It's totally wrong for me. You can ask Rishi too. But what I can certainly tell you is that the stand before there are not many people in the Conservative Party, or indeed in government, or indeed in the Conservative Party, who are more dedicated to cutting taxes, bearing down on taxes where we can, than the three people standing before you today. But I absolutely assure you the truth of that. But we face a reality which is that the fiscal position has changed radically from the one that we found ourselves in 2019, and we can. I think the economy is growing strongly. We'll come through this very well. I'm very impressed with the number of jobs that are being created, the growth that we're seeing, but we've got to be reasonable, and we've got to be pragmatic, and so we're taking the steps that we are. Thank you, Beth. Ben Riley-Smith of the Daily Telegraph.
Yes, thank you. Prime Minister, one quick question just to drill down on that again. At heart, are you really still a low-tax Tory when you think of your own personal ideology? And I will give you a third chance to rule out this Parliament any further tax rises if you want.
I certainly don't want any more tax rises this Parliament. If you want me to give that emotional commitment, of course that's the case. But there's a formality in these things, which is that fiscal matters are reserved. These are decisions that the Chancellor must make in the course of his budgets, and that's quite proper.
And to Tory voters, can you assure them you are still a low-tax Tory, because that's what you ran on in 2019?
I cut the my share of, when I was Mayor of London, I cut my share of the council tax by 20%, and I want to. I believe in living more money where possible for people to spend on their families and their own priorities. Of course, that's right. But what I just one point I would make to you, Ben, thinking about hard-working families who try to do the best for themselves and their families. This is something. This measure actually, by protecting people against catastrophic costs, it rewards effort and thrift and saving and people thinking about their family. And I think it's actually a profoundly conservative in its instincts. It helps people up and down the country who are working hard for their families.
I have one for the Health Secretary. When this reforms come into place, can you promise that no one will have to sell their home to pay for social care? Because that was how this whole reform was always pitched in the previous years.
What these reforms ensure is that people will now, for the first time, have complete confidence about the maximum that they'll have to pay towards their care. So that's the cap, the £86,000 cap, and no one will have to go beyond that. And that confidence means that they can plan much better for their future. They can manage their assets better because, as I said earlier, that 1 in 7 people at the moment are having to pay these catastrophic costs of over 100,000, and perhaps because they had dementia or something else where they just had annual costs going on year after year, and it wiped out their total assets. So that can end now because we're providing this confidence.
And you're bringing the magic of average to the rescue of the millions in the famous phrase. Mesa Hall at the Express.
Thank you, Prime Minister. You're breaking your manifesto promises to pensioners by not raising state pension in line with earnings. Aren't you missing a historic opportunity to improve what is one of the worst pensions in Europe, state pensions in Europe? Haven't pensioners got a right to feel betrayed, and aren't you effectively robbing them of £7 a week?
No, well, I hope not, Mesa, and I really don't think so. First of all, can I congratulate the Express for the campaigns that you run on behalf of pensioners. I think they're quite right, and we will always stand up for pensioners in this government. We believe passionately in that. What we're trying to deal with is a statistical freak caused by the COVID pandemic, so that one of the data in the triple lock jagged down and up again very sharply with a weird effect on pensions, and pensioners will still get pensioners will still be protected. They'll still get 2.5%. They'll still be protected against rises in the cost of living. What we're trying to deal with is that that big upward spike in earnings which was a function of the big downward spike caused by COVID. And I think most people can see that, I hope, and I hope that people can see that it's fair. But Rishi's only one to add to that.
I don't think anything to add. I think the Prime Minister used the word statistical anomaly, distortion, artificial. Those are not our words. Those are the words of all the independent commentators about this issue. And it's temporary. It's just for this year. And so hopefully pensioners will feel reassured that not only have we protected them in the past, we're protecting them this year with at least a 2.5% increase in pensions, or higher if the cost of living is increasing faster than that, and we will continue with the triple lock thereafter.
Great, thanks. Arj Singh from the Eye.
Hi, Prime Minister. Another one of your manifesto commitments was that you'd seek a cross-party consensus on social care reform to ensure that it stands the test of time. Why did you fail to do this, and are you concerned that the social care problem may not be fixed once and for all, as you said, as a result?
Thanks very much, Arj. And I do want to achieve a cross-party consensus where possible. But one of the interesting things that came out in the statement just now in the House of Commons was, of course, that there was a cross-party agreement by the Committee on Social Care that there should be a levy paid for taxation, out of Nhsc. I think, in fact, they even said, and so there were members across the House who backed that proposal. This is identical or very similar to the one that we're coming forward with today. So I do hope that colleagues across the House will see that what we're doing is the right and the progressive thing to do, that the burden is being borne overwhelmingly by those who are most able to bear it, and I hope that that people will support it in the House of Commons. And I was encouraged by what I was hearing this afternoon from colleagues across the House, actually, and not just from our benches, from other benches as well. Okay, folks, thank you all very much. Thank you.
You've had in a long time. It'd be great to ask you about one of the fundamental.
Yes. So let me hang on, Pippa. I'll get a Pippa. Okay. Right. I can see. You see, my objective in asking for not independently targetable questions was to try to give you all more of a chance. Okay. We'll get a Pippa and then Tom. Oh my goodness. Right. Well, I think here's what we're going to do. We're going to take 5 more. All right. And I'm going to be draconian, arbitrary, and ruthless in the way I decide to appoint these. I'm going to go to Pippa first.
I just wanted to ask a little bit more about the care funding aspect of it, which was announced today, the 5.3 billion over 3 years. I mean, some of the care providers are very anxious about this. MENCAP has said it's not going to be enough to fix the care crisis now. The UK Home Care Association says it's nowhere near enough. Census described it as being social care system treated again as the Cinderella service when compared to the NHS. Is £5.3 billion over 3 years really enough, given only half of it will be going on reform? How easy will it be when that moment comes to an end to transfer, if you like, that cash from the NHS backlog to the social care system? And for the Chancellor, is there more money likely to be available in the autumn statement specifically for social care?
Thanks very much, Pippa. Well, on local councils and social care, as you know, we put billions in already throughout the pandemic, and the objective of the levy is to ensure that social care gets properly funded. But as the reforms kick in, the increment going to social care goes up. But Saj,
what I'll add to that is that this is on top of the funding system that already exists. So this is your fresh new funding, £5.4 billion over the next 3 years. And in terms of exactly how it's going to be applied, so for example, the £500 million for workforce trading, we will be consulting with our colleagues in the sector and working with them on what's the best way to use that, listening to their ideas, equally on the fair cost of care, working with local authorities across the country to see how best to use that money.
Great, thanks. Tom Newton-Dunn.
Prime Minister, one for you or possibly your Chancellor, since you've kindly devolved all tax-raising questions to him as First Lord of the Treasury. You've hypothecated all this money for the NHS and social care. You'll say that's going to be legally ring-fenced. But what happens come 2025? You haven't paid down all the money you need to pay down for the NHS for COVID catch-up. Will you then keep that 12 billion a year, keep on going into the NHS, or will it be then hypothecated for that moment onwards into social care? For in other words, will the NHS get the never-ending £12 billion a year extra, or how do we know this money actually will go to your social care plan?
Because that's what we're setting out today, and as Saj has just explained, the reforms and improvements in social care go upwards in expenditure terms over the coming years. But the priority right now is fixing the electives, fixing the backlog, paying for the nurses that we're recruiting in huge numbers, doing the vaccines, but also recognising that you can't expect in the long term to fix these problems unless you also deal with social care. But any colleagues want to add to that? Heather.
Follow up to that one really, which is what proportion, so it's less than £1 in 6 of this tax increase that will be going to social care in the first 3 years. I wonder what you expect that proportion to be in, say, 5 years' time or 10 years' time. Will it ramp up quite quickly, the proportion that goes to social care? When will it be 50-50? And just, Prime Minister, are you going to reshuffle your top team this week?
You could take the last one.
You do the second one.
But just on that, the proportions we set out for the next 3 years, I think most people understand there's a lot of assumptions we've had to make here in terms of the prevalence of COVID, the future direction, is that will have an impact both on NHS and social care. And then also an assumption around how much of the sort of missing treatment. So we estimate there's about 7 million people that normally, in normal times, would have come forward to the NHS for treatment. They stayed away at the height of the pandemic. We all understand why that happened, but we have to make an assumption around how much that will bounce back. So I don't want to say, after 3 years it will be exactly this split, but what we do know is that we'll be able to certainly deal with a huge amount of the backlog of the next 3 years, and more proportionally of the funding through the levy will go towards adult social care.
But you don't think you'll have dealt with the whole backlog in the next 3 years?
We're going to try and tackle as much of the backlog as we can.
And we've got to be realistic. Unless we do this, we can't deal with the backlog in the way that I think the British public need. This is fundamental to putting our NHS back on its feet post COVID. Harry, and then Jason, and then that's it.
You didn't answer Heather's question about the reshuffle, I know. But, Prime Minister, do you still admit that national insurance is a regressive tax that will hit your constituents harder than it will hit any well-paid MP, as you told the House of Commons in 2002? And a question for the Health Secretary. If you were still doing the Chancellor's job, is this exactly how you would have fixed the COVID backhole?
Harry, just quickly, just really to repeat what I think I said to Beth earlier on, this is the IFS have today come out and said that this is a measure that is both progressive and broad-based. It's the right way to raise the sums that we need and to fix the electives, fix the backlog, and deal with social care.
I agree 100% with the Chancellor. He's been trained well.
Okay. Right, Jason.
Yeah, thank you. Businesses saying that this is a tax on jobs. I mean, you guys used to say this is a tax on jobs. Do you accept what business leaders are saying, that this will have an impact on jobs? And while we're talking about jobs, Prime Minister, put these guys out of their misery. Is there going to be a reshuffle?
Okay, right. Look, first of all, what can I just say, having praised the Daily Express for campaigning for pensioners, I do think it's right to say that the Daily Mail has run a historic campaign on the issue of social care. You have had it on your, it's been part of your battle cry for a long time now, and I think it's been the right thing to call for, and this government is delivering it. So I congratulate the Daily Mail and its readership for what they've said on this, and I think that it's fundamentally right. But you can't do that without some tax raising, particularly given the current context, and that's why we're taking the exceptional measures that we are, and they're framed to deal with these interlinked problems of pressures on the NHS, greatly accentuated by delayed discharges, and alleviating that problem of delayed discharges with finally a fundamental attempt to grip the issue of social care. So I hope that it finds. I think it's totally the right thing to do. And on your point about the economy, and whether this will take the air out of the tires, take the wind out of the sails of the recovery that we're seeing, I don't think so. But perhaps I'll ask Rishi to say a bit more about that.
Jason, so because of the way that we've done things in the past, the smallest 40% of businesses, so 650,000 businesses, won't be affected by this at all. And that's because of the employment allowance, which we increased in the first budget that I did. The next 40% of businesses, so another 650,000 or so, will face an average increase of about £450, which for context is about 0.1% of their revenue and less than 1% of their wage bill. And 70% of the contribution from businesses will come from the largest 1% of businesses. So that's the impact on businesses, which again is similar to the personal side, is I'd say progressive. I think you asked about the impact on jobs and supporting jobs. I think the labour market is performing incredibly strongly. Over a year ago, we put in place the plan for jobs. We announced that. We knew that jobs would be incredibly important. And back then, people were expecting unemployment to peak at 12 or 14%, millions of people unemployed. People now think that unemployment may have already peaked at less than 5%. That's 2 million fewer people out of work as a result of the interventions that we've put in place. We've had now 8 months of more and more people coming into work, 6 months of the unemployment rate falling, and we are continuing to support people into work and support businesses to hire them, whether that's through apprenticeship incentives, or if you're a small company, we're giving you £3,000 to take on a new apprentice at the moment. We've created a Kickstart scheme where we're fully funding high quality jobs for young people with businesses. So across the board, I think we are doing an enormous amount to get people into work and support companies to hire them. And you can see that in the statistics. Our plan for jobs is working.
Okay, thank you all very, very much. And if I've avoided yours and Harry's question about more political matters, that is because this is a press conference that is focused on I think what matters to the people of this country, which is building back better from COVID, fixing the backlogs in our NHS, and fixing social care at the same time. Thank you all very much. Thank you. Thank you.